On the Now Morning Show, we want to get you to be the healthiest, best you that's possible. So, we've invited back the Freeport Medical Clinic to join us on the Now Morning Show. Dr. Rohit Das, Medical Director at CEO at Freeport Medical Center, joins us on the Now again. Good morning to you, Doc. Welcome back.
Good morning to you. Good morning to all our viewers this morning. I'm really happy to be here actually to discuss our important topic this morning.
I'm excited for this topic. This morning we're talking lung health, right? Let's start with some basic things. Asthma and COPD. What are those things and why are they significant health concerns here in Trinidad and Tobago?
Yes. Both asthma and COPD are what we'll consider very common problems worldwide.
Before you get on there, tell me what COPD is.
COPD, it's short for chronic obstructive pulmonary disease.
Okay.
Right, and it's, well, I'll go into it in more detail in a minute or so. But both of them at our clinic at Freeport, we see lots of patients with this problem. Mm-hmm. And what we have found is that a lot of times patients' treatment is delayed because probably they were not diagnosed properly, as the case may be, especially in COPD. And most of the times, in both instances, patients would come to us with cough, like a crunch. So sometimes they say they have a cough going on for a few weeks or sometimes even months in the case of COPD. Shortness of breath. Some patients may say that they're having a chest tightness, particularly in asthma, and sometimes patients may wheeze. Right? And so they have these symptoms and then they come to us. When they come to us, we, of course, the doctors will examine them and so on. And what we have found is that asthma, particularly asthma, it's common. In Trinidad, what we have found is that about 1 in 5 to 6 children will have asthma. 1 in 5 to 6 is very common. And for COPD, it's like over the age of 40, you will find like about 10% of patients coming in, adults, of course, right? So asthma affects mostly children, but it can also affect adults. Mm-hmm. So we have what we call adult onset asthma. And if I'm to say a little bit about the pathology, asthma is like a disease, a chronic lung disease, but it is due to a hypersensitivity of the bronchial system. So when a person inhales allergens or some impurity in the air, it will cause a reaction, and that reaction now will cause the lung to respond by inflammation. So you have inflammation in the lungs, you have bronchoconstriction, and sometimes patients may have airflow obstruction. So patients come to us with short breath, chest pain, and that's why inflammation causes the fluid in the lungs. That's why they have a cough. They have that kind of cough. The mucus.
You mentioned impurities in the air. You said allergens, pollens, that kind of thing. But the thing that we've been struggling with a lot is the Sahara dust.
Yes.
Can that affect?
Definitely. During the dry season, we see a lot of patients coming into us with wheezing. The person may not be asthmatic, but they may have gotten the virus, for example.
Right.
And there's something called bronchoconstriction, where the dust from the air causes a reaction again with the mucous membranes of the lungs. And as it causes constriction, this is where the problem where they start wheezing. With respect to COPD now, it's a different type of pathology where the lungs is damaged due to chronic exposure to impurities, and a majority of it will be due to cigarette smoking, tobacco use, and that damage causes scarring of the lungs and the bronchial system, as well as it can cause, again, restriction and damage to the alveoli. The alveoli is that unit in the lungs that is responsible for moving oxygen into the blood and taking carbon dioxide out.
Yeah.
So that's why patient knows the oxygen start dropping and things like that. So, COPD the pathology is different, but they still present the same way with cough, short breath, and
in terms of the tearing of the lungs, right? Would you be able to feel that?
Sometimes patients, they come to us with pain. Now the pain is from the chest; it's not necessarily from the lungs itself.
Right.
So you wouldn't feel the scarring and so on taking place. It's a very, very slow process over many years. Hence the reason why COPD is more common in the older age group
Yeah.
as opposed to asthma being in the younger age group.
How important is it to get early diagnosis?
Yeah, I would say asthma and COPD, it's extremely important to be treated early and to be diagnosed properly and get the proper treatment. In that, to prevent, of course, persons having a poor quality of life, because COPD generally causes you to be tired, drained, you lack energy because you're not getting sufficient oxygen into your system and the carbon dioxide out. So of course, when you come to us, we would examine you properly, and when we sung your chest, we would hear that wheezing, that what we call rhonchi in medicine, and of course the air entry, like the airflow, is not, you will not be getting a full breath. So even though you are breathing, you feel you're breathing a full breath,
Yeah.
but your lungs have a way of compensating, so you're not feeling it. But when we listen, you don't hear a full breath. And that's important for us, for the doctor. And then, of course, in diagnosing the patient, you have to do an x-ray of the patient to make sure there is no other problems. Blood tests may be necessary. And a very important test known as a flow meter. I don't know if you know anybody who has asthma. When they go to the emergency department, they make them blow into an instrument.
Yeah.
That's called a flow meter test. The flow meter test checks to see how much air you can blow out in 1 second, in the first second.
Okay.
And then you do lung tests to diagnose COPD. If the patient is suspected of having COPD based on the examination, there's a test called a spirometry test. Spirometry is where we check the patient's amount of air they can blow out in the first second and the forced vital capacity, and it should be 80% and up. If it's below that, then they have started to develop COPD.
Tell me about treatment plans for both asthma and COPD.
Yeah, that is a very important thing. I like to talk to it. I will touch on it because it's so detailed.
Of course.
Yeah. Asthma and COPD, both of them are treated like in the acute phase. Like, let's say a patient gets an asthma attack, you treat that, and then we also go into preventative, so control measures. And depending on the severity of it, patients may need anti-inflammatory injections, like, for example, a corticosteroid injection they may need. Or in some cases, patients may need antibiotic injection and so on. Once the patient is diagnosed properly, we treat the acute phase. They may need oxygen therapy. And there's something called nebulization. Nebulization is where you put a patient on medications known as bronchodilators and other medication, and they inhale it for a period of maybe 15 to 20 minutes, sometimes up to half an hour, to give the medication straight into the lungs and to allow the lungs to start relaxing and help with the inflammation. As you know, inflammation is the root cause of a lot of things.
Yeah.
And once we get that under control, then we can put patient on inhalers and other different things like that. An important test that we didn't talk about is a CT scan. Sometimes a patient may need a CT scan as well to check for air trapping and other things in the lungs.
Doc, are there ways that we can rejuvenate our lungs? So without
Yes.
all these medical treatments, if you don't want to go through this whole process, before you even get the asthma attack, before you even see that the damage is done, are there ways that we can take preventative measures to say, all right, I'm making sure that my lungs are as strong as they can be, are at capacity, are healthy?
That's a very important question also. So the first thing is like prevention.
Right.
Prevention. And so the first thing is you really need to keep away from the impurities in the atmosphere. And there is a lot of impurities. For example, let's say occupational hazards, for example. A mechanic, he might be doing, a diesel mechanic, let me just use this.
A decent one, you say?
Yeah, diesel, because diesel fumes.
Oh, diesel. I thought you said decent, you know?
Sorry.
All right, yeah, so a diesel mechanic.
Yeah.
Fumes he dealing with.
You see, they inhale a lot of the carbon monoxide and carbon dioxide fumes and hydrocarbon fumes. And these fumes cause damage, but again, is a slow, long-term process.
Yeah.
And I mean, these guys, that's their source of, living, and that's how they
So should they be wearing masks?
They should be wearing proper masks.
Okay.
Micro, very fine to filter the air properly.
Okay.
And so let's say joiners who the sand lumbar,
Little
these
particles.
particles, and
Yeah.
they're inhaling this. So I mean, these guys are innocently doing their job, and but it's causing damage to their lungs. Miners, people who work in the sand and gravel industry, cement industry, a lot of cement fumes can damage your lungs.
And I mean, as we mentioned, the Sahara dust
Sahara
generally.
dust
So at
generally.
this point, we should all just be walking around with proper masks like we back in 2020.
Yes.
All right.
Yes. And of course, the tobacco. Tobacco use is the number one cause. It has been shown, and what we have seen is about 70% of the patients with COPD would usually come from tobacco use and abuse.
Tell me how long they've been smoking before they start seeing
Generally,
signs.
we see patients come to us with cough and so on after 10 years of smoking. It depends as well of how much.
Right.
Some patients, I have had a patient smoking 3 packs a day.
3 packs a day?
3 packs, very, very bad, horrible. So in that case, it will happen even before. So it
Yeah, that's
depends.
abuse.
Yeah, way past abuse.
Wow.
Yes. So,
But is there a way that even at 10 packs is plenty, right? To
Yes,
come back
yes,
from,
yes,
right?
yes,
But
a
let's say you're a smoker and you decide, I want to get better. I want to rejuvenate my lungs. Are there any things that you can do? Or is it if you're
Yes.
smoking 3 packs a day,
Yes.
you're gone. You can't be helped.
It's similar to any type of addiction, right? Remember, it is an addiction due to the nicotine, which is getting into your blood and causing the withdrawal when you try to stop. So, of course, you have to make up your mind very strongly. And I've had patients with heart disease, and I beg them to stop, and they stop for a few weeks or months, and then when you see them back after 3-4 months, they go on back to the same thing. So you have to make up your mind. It's really something you have to make up your mind very strong. And once you make up your mind strong to stop, we have nicotine patches, we have the nicotine gums, nicotine sweets, and so on that you can use for the withdrawal symptoms to stop.
Now, we're speaking a lot about tobacco, but what about marijuana? Is there a
Yes.
difference in terms of the smoke, or is it just the smoke aspect of things?
Well, in the case of marijuana, it will be the dust when you inhale when you pull and the fumes get into your lungs, because
So it's not the same smoke?
not the same nicotine, because
Well, right.
obviously is the
But have no
is the
nicotine in
dust.
that, yeah.
Yes, correct.
Okay, but it's not the actual smoke itself
No,
that
it's
causes
not
the
the
problems.
actual
Okay.
THC. It's
Interesting.
not the actual THC.
Well, we have a couple minutes left, and I really want to get into Sunday because I know you have the 5K run walk for
Yes.
Healthier You happening this Sunday, and I want to make sure we get in that information before we wrap this morning. So tell me what's going on Sunday.
We are very excited. I've been talking about this for the past few weeks. On the 17th, which is this Sunday, we are having the Health Fair Family Day, and it's starting off with the 5K, which is Walk or Run for Healthier You. That's our team. We have a lot of persons. It's a free event. A lot of persons have already registered to attend. It's starting at our office in Freeport, and it's going to the arena Savannah, right? And it's an event where a lot of people are looking forward, because we have added some nice prizes to the event.
Tell me about the prizes.
Yes. So for all of the places, first, second, and third, we are giving a full medical. We're also giving a free doctor visit and a trophy. First, second, and third, both male and female.
And they get money too, eh?
And also we're giving
All right,
a cash
tell
prize.
them everything they get in.
They get a prize. So first place will be $1,000 for both male and female.
Right.
$500 for the second place, male and female. And
5, I seen 750 here.
$750.
Yeah.
Well, okay.
Yeah, man, you ain't know much money you're giving out.
No, we had agreed on 5, but if they
All
increase
right.
it, well, we will go with the
Well,
750.
boy, they went behind your back and look like yes.
And a $250 for the. You have
Third place, yeah.
Right, third place, right. $250, that will be the cash prize. We're also giving for the first child below 12.
Right.
We're giving a $250 back to school voucher and also a trophy.
Nice.
And we try to encourage the persons over 50 to come out. So we're having same free medical, doctor visit, and a trophy for the 50 to 60.
Right.
And the over 60, we're giving that plus a free diabetic sugar machine as well. So it's we're trying to make it very attractive. Even though it's a free event, we still adding in these prizes and stuff
But
like
not
that.
just that, it's prizes that you can actually use and can
Yes,
actually
yes.
benefit you and your health going forward. So it's not just about the fitness level for you to do the actual 5K, but even afterwards, you get the opportunity to continue monitoring your health.
Exactly, yes.
Dr. Das, we are out of time this morning, but any final messages that you want to leave with our viewers before we wrap?
I am really compassionate about lung health. I tell my patients you can't live without your lungs. It's just like your heart. I mean, if a person have a kidney problem, they can do dialysis and still live, and you get blind, you can still live. But your heart, your lungs, these are vital organs, right? We need to protect it. And we at Freeport Medical Center, we are fully equipped to do all the diagnosis, the same lung function tests, the CT scan, X-ray. We would like to treat patients with these problems, and we like to let patients know if you have shortness of breath, chest pain, chronic cough, and more so if you feel like it's feeling stifling or your chest is not expanding good, you need to come in and see us and let us take care of you.
Let them take care of you, ladies and gentlemen, at Freeport Medical Center. Dr. Rohit Das, the Medical Director and CEO at Freeport Medical Center, joining us this morning to give us some information on lung health and how you can be a better version of you. Doc, I will talk to Sayo before we leave, right? All right, let me take a quick break and we'll come back with more on the Now Morning Show.
Yes.
Stay tuned.
Yes, thank you very much.